Hey, what's up guys? Welcome back. In this video we're going to carry on and speak about chapter 1 of anatomy, and in this video we're going to be looking at how the body is creatively designed to separate its anatomical structures from one another in such a organized manner. So before we do continue, we're using Clinically Orientated Anatomy by Keith Moore. So if you want, you can get the book and you can follow along with the videos. I am covering all of the important information and I'm going page by page, so you might find this very useful. Okay, so what are we going to do today? So first of all, we're going to go over what are fascias. Essentially, fascias are a covering sheet or connective tissue that's used to separate organs from one another. Number 2, we're going to go over fascial compartments. Then we're going to look at these other structures called bursae, which are used essentially to help the movement of one anatomical structure over another. They're like fluid-filled sacs. They're fluid-filled sacs that are used to reduce friction. And then we're going to look at some potential spaces, and after that we're going to do some clinical correlates, just so then you can get an idea of why everything we just studied is important, and then we'll wrap up. Okay, so let's get started. But before we do get started, let's just get one thing straight. It's really important to just appreciate and just understand that our body is so organized. The way that it's designed is so creative and it's so efficient. If you imagine how compact everything is in the body, despite how much is going on inside us, there's got to be some kind of genius behind this organization. And one of the key reasons, or one of the key ways the body is organized, is by effectively compartmentalizing its anatomy. So in other words, the body is really good at separating anatomical structures and fitting them together so that everything is nicely and tightly compact rather than wasting space. And so the reason why I'm saying this is that fascias, they play a very important role in this. So let's understand what exactly fascias are. So essentially, if you remember from last videos, or if you didn't watch the video, you can go back and watch it, or you can just try and imagine it. The top layer, of course, of our human anatomy is our skin. And then the skin, we said from last time, is split into an epidermis, and underneath that there's a dermis. And then underneath the dermis, we said that there was a layer called the subcutaneous tissue, which essentially is the superficial fascia. And then underneath the superficial fascia, there is the deep fascia, and then you find the muscles. So if you want to draw a simple picture, essentially you have your skin, and then underneath your skin you have some loose connect, and then underneath that you have your muscle, and then between the loose connective tissue and your muscle you have a dense layer of connective tissue, okay, which this dense layer is your deep fascia. And then the loose connective tissue is this layer, and your skin, of course, is your skin, and your muscle is your muscle. So the reason why I explain this is that a fascia is essentially a covering layer. Okay? It's like a sheet. So it's actually, in Latin, the word means band in Latin, and it's just to wrap around something. Okay, so it's a band or sheet of connective tissue, and it's made of collagen. Remember, we said from last lesson, connective tissue is made of collagen, and it's located beneath the skin, and it's used to stabilize, enclose, and separate muscles, essentially, or other organs. Okay, so you can imagine a fascia as a sheet of connective tissue that covers things and it separates things from one another. So remember at the beginning of the class I said that the body is really good at separating its anatomical structures from one another and fitting everything together. Essentially, it does that by using fascias, by using this connective tissue and wrapping it around. Okay, so there's three types of fascia. So there's a superficial fascia, which I said was this one here, and then there's the deep fascia, which is the sheet of connective tissue around the muscle, and then you also have something called visceral fascia. And essentially, visceral fascia is the deep fascia for the organs. So when you think of deep fascia, you think of muscle, and when you think of visceral fascia, you think of organs. So viscera, it literally translates into organs. Okay, this is like where medical terminology is very handy. If you know medical terminology, it makes things a lot more simpler. So if you want to remember anything from this slide, just remember that the word fascia means to wrap. It's like wrapping paper for an anatomical structure. Okay? Right. Okay, so let me just ask you this question. So what is a fascia made of? So you can guess this by having an educated guess, but what I encourage you to do is don't wait for me to tell you the answer. Either you know it now and that's great, but if you don't know it, what I would encourage you to do is pause the video quickly, search it online. It will take you 1 minute to figure it out. I do consider these videos as an educational videos in regards to learning the skills of studying medicine as well as teaching you the information. So it's a really important skill as a medical student and as a doctor in the future to be able to research information and retrieve information online. So try and figure that out. What is a fascia made of? Okay, so the answer is connective tissue. So I did say that in the slides that were before. If you got it right, great. If you didn't, well, now you know it. So here's the next question. So what's connective tissue made of? So this is a fascia. It's a sheet that wraps around an organ. But let's say that this is your muscle, okay? So we said that this here is made of connective tissue, but what's connective tissue made of? And the answer is collagen. So remember, collagen is a type of protein, okay, and it's like a band fiber, and it intertwines and it creates like a strong net, which then turns into a sheet of connective tissue, and that is essentially what a fascia is made of. Remember, it's a good idea to search online, read about it. It'll take you 1 minute, and then you can come back to the video, and you would have learned a lot that way. Okay, so let's continue. So why do we need fascias in general? So the three main functions are to cover the structure. Remember, fascias are like wrapping paper. They wrap the anatomical structure. So you can look here. So if let's say that this is your bicep. superior fascia is this one here. It wraps your entire muscle. Okay. But then you also have fascia inside the bicep that separates the bicep into smaller units. So remember, this is like the compartmentalization. It makes everything very, very effective. Rather than it being very random and very messy, it separates anatomical structures from one another, but it also makes the muscles themselves inside very organized as well. Okay, so one function is to cover the structures. Another function is to connect things together. So you'll read in the book that it says that the fascia, what they do is that they become very dense when it comes to the end of the muscle, and that helps the tendon attach to the muscle and to the bone. So fascias are very useful in connecting things together. If that's hard for you to understand, you can just remember that this is made of connective tissue. Remember that connective tissue, one of its functions is to stick things together, basically. And then the third one is compartmentalization. So it separates structures from one another. So here you have let's say you have your bicep, but then you might also have your coracobrachialis also, because on your arm you have your bicep, okay, but then you also have your coracobrachialis as well, okay. So the body doesn't want these muscular fibers to be scraping on one another and maybe the fibers mixing with one another. So what it does is that it separates them, it covers them, and it separates them from one another. And inside the muscles as well, it separates units of muscle so that nothing gets mixed up and everything is very organized and tight. Right, okay, so these are the functions. Quite simple, no need to really go into too much detail. Okay, so let's look at the type of fascia. So remember we said there's 3 types of fascia. There's superficial fascia, and you want to think of skin when you think of superficial fascia. Then there's deep fascia, and when you think of deep fascia you want to think of muscle. And then there's visceral fascia, and when you think of visceral fascia you think of organs. Okay, so far what we've done is that we've talked about the general structures of fascia, general functions of fascia. So we said that they're useful for connecting things, for covering things, and they're useful for compartmentalization, to separate things from each other. So all of these functions you can use for for the superficial fascia. It has these functions. Deep fascia has these functions. Visceral fascia also has these functions. So let's look at superficial fascia. So superficial fascia is another way of saying subcutaneous tissue. And if you remember from the last video, what was the function of subcutaneous tissue? Right, so the function of subcutaneous tissue was to essentially stick the dermis to the deep fascia. In other words, it's the connection between the skin and the muscles. So that was one of the functions. The other functions, of course, was to store fat. So if we go back, okay, I just want to make things clear for you. Oops. So here we have the dermis, here we have the skin, and underneath the skin we have the superficial fascia. This is the subcutaneous tissue that I was talking about in the last lecture. And then underneath that you have the deep fascia. Okay, so let me just get back to that slide. So its function, the superficial fascia, is the same as what we said for the subcutaneous tissue. So its function is to connect the skin to the muscle and store the fat. The deep fascia, remember, what should you think when you think of deep fascia? Muscle, exactly. So it's a dense connective tissue. So this is dense connective tissue. This is quite a loose connective tissue. So do you remember what why it's so important for the subcutaneous tissue to be loose? So yeah, so the reason is that you want the skin to be stretchy. Because we're moving all the time, and especially where the skin around your joints, where it's constantly bending and flexing and rotating, you want the skin to be able to cope with that. You don't want cracks in your skin. You want the skin to be able to stretch and bend with your joints. Whereas your deep fascia, it has to be tense because it has to hold your muscles tightly together. It can't be loose, and there can't be any space between the fascia and the muscle. It has to hold it really tightly together. And the deep fascia, it also has a very important role in splitting the muscles into groups. Remember in this video here, in this picture here, the fascia, it split the muscle into different compartments, and that's really important so that the muscle can contract really effectively and really powerfully. And it creates a sheath for the nerves and the blood vessels to run through the muscle. Okay, and I'll explain that a bit more in this image here. Right, so as a recap, here's your skin. Underneath your skin you have your superficial fascia. What's the other word for superficial fascia? Yes, subcutaneous tissue, exactly. And is the subcutaneous tissue dense or is it loose? Exactly, it's loose connective tissue. And why is it important for it to be loose? Right, so that it can be stretchy. And then here you have your deep fascia. So your deep fascia, what's its main purpose? Right, to cover the muscle, to wrap the muscle. And is the deep fascia, is it loose or is it dense? Exactly, it's very dense. And why is it dense and why is it not loose? Yes, so it's dense so that it can hold the muscle tightly together. If it was loose, then it would be it would have a lot of space in it. It would be like a bag, essentially, not a tight fit. Okay, so let's go back. Let's look at the functions of deep fascia using these images. So we said the first function was to cover the muscle. Okay, so if you look here, you can see that the fascia is represented by the blue line. So the blue line here is clearly covering the muscle. So if you're wondering where this muscle is, this is your leg. Okay, and this is this is actually your arm, your forearm. Okay, so here is your ulna. Okay, and here's your radius. So this would be your left arm. So the fascia here is the deep fascia. It covers below the skin and it covers the muscle. That it compartmentalizes. Okay. And what it means by compartmentalization, okay, that was not very clearly written, but you can look back here. Okay, you can look back here, splits muscles into groups. Okay, you can just remember it like that. You can see here that this is the deep fascia, okay, like this. So it's essentially a circle. Okay, you can think of it like this. A ring of connective tissue surrounding the muscle. But then you can see here that what it does is that from the outside it kind of goes inwards, okay, and it splits the muscle into different groups. Okay, it splits the muscles into sections. Okay, so it comes out, that it extends into the middle, okay, and it goes back and it extends into the middle here and it wraps around like this. And what that's doing, just like this image here, this actually is drawn a little bit incorrectly. It's supposed to go inside, so the ring is around like this and then it will extend into the middle. Okay, so that's one of its functions as well. It compartmentalizes the muscle. And then the third structure was the third function was it creates a neurovascular sheath around the vessels. So here around the vessels, when it reaches the vessels, it will actually wrap the vessels like this, okay, and here there's actually some tissue, some fat. It would have also wrapped these vessels tightly so that it separates the nerves, the arteries and the veins from the muscle itself. And again, it's done so that everything is tightly compacted, tightly organized together, right? So here I'm just going to draw you an example of what I mean by that. So let's say, for example, we're looking at the leg, okay? I'm going to say that I'm not going to say that there is, I'm not going to say exactly what muscles are in the legs, but let's say here you have your one muscle, let's say muscle number 1, muscle number 2, and muscle number 3, and here you have your tibia, and here you have your femur. Okay, this is a very inaccurate drawing, okay, but still it will get the point across. So around the edge you have your deep fascia, okay, and then so obviously the skin is lying outside, but then what it does is that it goes into, from the deep fascia here, it will extend between the muscles like this, okay, and here it will extend between the muscles as well, okay, and let's say here that there's some blood vessels and some nerve fibers, it will wrap around almost like it's all one sheath, but it's folding on itself. So that was the deep fascia. The next one is visceral fascia. So visceral fascia, again, you should think of organs. So it is a fascia for organs. So this is a double layered connective tissue. And what it does is that it covers the organs and connects the organs to the walls or other structures around it. Okay, so what I mean by that is that, if you have, let's say that this is your, let's say this is the person here, okay, then then this is their chest, and this is their abdomen here. Okay, and this is their legs. Okay, so this is their thorax here. Okay, so this is the abdominal wall. Okay, and then the visceral fascia, essentially what it is that underneath the skin and the subcutaneous tissue, you have your dense layer, which is that's your muscular wall, and then you have your muscles. Okay, so here you have your muscles, and then you have a piece of connective tissue, which then okay, I'm not really explaining this too well. So essentially you have, let me draw it like this. Let me go back. Let me draw it like this. So you have your skin first, then you have underneath that you have your subcutaneous tissue like normal. Okay, so here we're drawing this, the abdomen, and then underneath your subcutaneous tissue you have your deep fascia, and then that's surrounded by, that's covering your muscles of your abdomen, and then underneath the muscle of your abdomen you have your visceral fascia, because here you've got, let's say for example, you've got your stomach. Okay, let's draw your stomach here. So the visceral fascia, what its job is, it's a double layered fascia. Okay, so the first layer, the parietal layer, this is stuck to your abdominal wall like this. Okay, and then your visceral layer, visceral meaning organ, what its job is, it's located like this. Okay, it's stuck to your parietal layer, but then when there's an organ, it stretches out onto the organ. So it creates almost like an infold, folding around the organs, and this space here is known as the abdominal cavity. Okay, I hope you understand what I mean. So essentially what it is that you have two layers. You have two layers of connective tissue that are stuck to one another, but the layer that's closer to the organ, its job is to wrap around the organ, whereas the layer that's stuck to the wall of the abdomen will always be stuck to the wall of the abdomen. So in turn, what you're getting a kind of you're forming a cavity. Essentially, you're forming, in this space here, you're forming an abdominal cavity, and in this space here, that's where all your organs are going to be kept, and that's how your organs are held in place. That's how they're not all kind of falling all over the place. Like if you're jumping up and down, they're not going left and right, they're held stably. And at the same time, this space here, it reduces friction between the organs, and it kind of gives it a little bit of space to function, right? For example, your bowels, they need to contract, so there needs to be a little bit of space, so it can't be really tightly packed like the muscles, so it needs that extra space here to be able to move around and function a little bit. So I hope I explained that well. So to talk about it in words, essentially the visceral fascia is connective tissue for the organ, and it covers the organs, it connects the organs to the cavity walls, so it holds it in place, and sometimes it can even connect it to other structures. So the outer layer of the visceral fascia is known as the parietal layer. That's the layer that's stuck to the wall of the cavity. It's stuck here to the wall of the cavity. Let me just go back to that slide. Whereas the inner layer is called the visceral layer. Remember, visceral means organ. So between the two layers, as we said, there is a fluid that keeps everything quite slippery. So the visceral fascia is different depending on the organ. So we don't generally just say visceral fascia. Sometimes we want to be more specific. So if we want to talk about the visceral fascia that's surrounding the heart, we would say the pericardium. In other words, peri means surrounding, cardium means heart, so pericardium, surrounding the heart. If we want to talk about the visceral fascia of the brain, we say meninges. If we want to say the visceral fascia of the lungs, we say the pleura. And the reason why we want to use specific words is because there can be problems with these visceral fascias around these organs. For example, in some cases, you can get inflammation of the visceral fascia surrounding the heart, and that can cause a condition called pericarditis, the inflammation of the cardiac sac, and that can lead to several problems like chest pain. You can get tachycardia, you can get a fever, and normally that's caused by a lot of different things. In the meninges, sometimes there can be several problems. You can get meningitis, for example, which could be bacterial, it could be viral, it could be fungal. And normally the patient will present with things like a headache, a stiff neck, a fever. Those are the typical signs. And obviously, any kind of inflammation of the lungs, such as pneumonia, will cause an inflammation of the the pleura. So the visceral fascia around the lungs will get inflamed, and that can lead to a lot of fluid building up in the lung sac. And the reason why I'm giving you these clinical correlates is just to let you know that it's important that we specify the names, or we give names to the visceral fascia surrounding different important organs, so that instead of saying the visceral fascia around the heart was affected, we can simply just say the pericardium was affected, and then the doctor will immediately understand. Anyway, okay, so the tonicity of the visceral fascia versus the superficial fascia. So what do I mean by tonicity? Here I simply mean the density. How stretchy is it? So what do you think? So we said before, what do you think the superficial fascia should be? How stretchy do you think the superficial fascia should be? Right, exactly. We said that it should be very stretchy because your skin has to stretch. Your superficial fascia is located under the skin, and you want the skin to be stretchy, especially around the joints. You want it to bend and move and do all of that stuff. What about the visceral fascia? Do you want the visceral fascia to be stretchy, or do you want it to be super dense, or do you want it to be in the middle? So try and take an educated guess. Right, so you want it to be in the middle. Obviously, you don't want it to be like the superficial fascia. You don't want it to be super stretchy, because if it was super stretchy, remember that one of the jobs of the visceral fascia is to hold your organs in place. So if it was super stretchy, then when you're running or when you're walking, or your organs would be bouncing around in your abdominal cavity or your thoracic cavity. It would be a mess. But at the same time, you don't want it to be super dense, because imagine you have super dense connective tissue surrounding your bowels or surrounding your stomach. It won't be able to contract, or maybe it will be so tight that you won't be able to defecate. So you want it to be in the middle. You don't want it to be super stretchy so that your organs are bouncing everywhere. But at the same time, you don't want it to be super dense where it's just held tightly in place like the muscles and there's no room to move. You want there to be enough flexibility, enough stretchiness so that the organs can function, but at the same time they're held in a stable fashion. Right? Okay. All right, so moving on to the next thing. So we talked about the fascia. We said that they're really responsible for separating things and covering organs. The next important structure for you to understand is this thing called a bursae, and essentially it's Latin for a purse. So they're really just closed fluid-filled sacs. So imagine a balloon. Fill the balloon up with water, and then now let the water out of the balloon. What do you end up with? You end up with a wet balloon. Okay, so essentially bursae are like that wet balloon, and then just close off the balloon at the end, tie a knot in it. That's essentially a bursa. So it's like a sac, and the inner lining of the sac is wet, so it's slippery. And the body puts these bursae, these fluid-filled sacs, or you should actually say these wet sacs. They're not fluid-filled, they're not filled with fluid, but they're more damp and wet and slippery inside. The body puts these in areas of the body where it knows there's going to be a lot of friction, there's going to be a lot of structures moving and scraping along each other. For example, at areas of the bone. So when your quadriceps, or when the muscles of your legs, when the tendon is binding to your tibia. At this point here, your tibia, the tendon here, whenever the muscle of your leg is contracting and moving, this is going to be moving up and down, and it's going to be scraping on the bone. So eventually that's going to damage your tibia. That's going to damage the tendon here. So what the body does is that it puts this fluid below the tendon so that it can easily move. Just like here, see? Underneath this tendon, this is the tendon. Okay, underneath the tendon, remember tendons, they connect muscles to bones. So underneath this tendon here, in this space, they put like a bubble, like a fluid-filled sac that's squishy, and it can reduce the friction. If you look here, this is an emphasized example. At your shoulder joint, between your shoulder and your clavicle, you have another one of these sacs, and because it knows that there's a lot of movement at your shoulder, it knows that it's really bad for those tendons and those bones to be scraping on each other, so it puts one of these bursae here so that it can reduce all of that friction, all that tension, all that friction of these structures scraping on each other. Another place that it normally does this is that it puts it in places where the is very close, is pointy, and it's very close to the skin. This is your elbow joint. And remember that these are not fluid-filled sacs. They're not filled with fluid because they would pop, obviously, but they're more like a wet balloon where it's just slippery and it removes the friction. So sometimes actually what can happen is that these bursae, they can get inflamed, okay? And inflamed. And when they get inflamed, so it gets affected by inflammation, maybe it gets irritated or it gets injured, or it can actually become fluid filled. So there can be a lot more fluid that's inside it, and then you can get a swelling of that area. Right, so these are all the different places you can find bursae. So you can find them in your ankle, in your knee, your hip, your wrist, your elbow, your shoulder, your scapulothoracic region. So that's the region where your scapula and your ribs meet. So if you notice, the thing about each of these is that there's a lot of movement at the joints at these places. There's a lot of muscles that are binding to bones at these places, and there's a lot of flexing and rotating, and so there's a lot of friction. So the body puts these bursae at these positions to reduce the friction, so that the two things that are supposed to be scraping on one another, it puts something between them so then it's smooth. Right, so that's the end. And the only clinical correlate that we're going over today is how fascial planes relate to surgery. And it's quite a simple one to understand, but nevertheless, it's very important when it comes to surgery. The fact, basically, a fascial plane refers to the separation of the anatomical structures by the fascia. So if you have this anatomical structure and this anatomical structure and they're next to each other, it is the fascia, the connective tissue, that separates these. And oftentimes this anatomical structure will have its own fascia, and this anatomical structure will have its own fascia, and they'll be tightly placed together. And so for the surgeon, it's very useful for the surgeon to be able to find deep anatomical structures, because they're really well organized by the body. It's not mixed. So the surgeon can put his hand in, and he can separate structures, and he can reach a specific muscle, for example, that's quite deep, just by separating these fascia from one another. Another really important point of these fascia when it comes to surgery is that the surgeon doesn't have to worry too much about contamination. Or, of course, contamination is a very, very serious thing, but this organ or this anatomical structure is protected from any kind of contamination happen in this anatomical structure, because there's a barrier between it that's protecting it. So essentially, those are the 2 points that are relevant for this chapter when it comes to the clinicals. Basically, if you take anything from these slides, remember what fascia are made up of, what are the different types of fascia, and what's the main function of fascia really. The main function of fascia is really to cover the anatomical structures of the body, and that's what makes the body so organized and so well kept, and there's hardly any wasted space in the body, and it's because of these fascias. Okay, so the take-home points today. Unfortunately, I forgot to animate these, so they're all the answers are here. But try to answer these fairly by yourself. Try and cover the screen and try and answer each of these questions one by one. They are the main points of these lectures. Go over them, and once you've done that, you can try and review what we've learned so far. Always remember one thing about medicine is that don't study things separately. Whenever you want to study something, try and relate it to the information that you've studied in the previous pages. Remember that medicine is like building a house, it's like painting a picture. Every time you learn something new, it's like you're taking a brick and you're adding it to the house that you're building. So don't consider the first few pages of the book to be unrelated to this page, to this content that we're studying today. Everything, it's like you're creating a network of information. So try and make that your goal, to continue to make everything related to each other as you go along and study medicine. So with that said, please do subscribe and like. I am hopefully getting better at making these videos, and hopefully I am getting quicker as well. That's one thing I do want to do. I want to be more effective and efficient in the way that I teach these, because I don't want to make all of my videos an hour long. I do want to make it easy for you as well. So with that said, please do like and subscribe, and I will see you in the next video. See you.